Hello. Today, we are going to be going over signs and symptoms of drug and alcohol abuse. My name is Dustin Epperly. We're going to be starting off with marijuana. And within each of the slides, we are going to be talking about four main groups of symptoms: mood symptoms, behavioral symptoms, physical symptoms, and psychological symptoms. For the mood symptoms for marijuana, or THC, you may find the abuser feeling stoned or high, having feelings of sterility, pleasure, a sense of well-being, depression, and even anxiety. The behavioral symptoms may come out as slurred speech, and intense hunger, or the munchies, dry mouth, otherwise known as cotton mouth, impaired judgment, sleepiness, having the giggles or laughing, the inability to sleep, and addiction to marijuana. Some of the physical symptoms are reddening of the eyes, coughing, increase in phlegm production, increased respiratory infections, impaired coordination, and impaired reaction time. You may see the blood vessels in their eyes expand. The bronchial passageways will relax and enlarge. Tachycardia, hypertension, or even heart attack. Some of the psychological symptoms are paranoia, lessened cognitive ability, decreased memory, heightened sensory perception, altered perception of time, inability to form new memories, having delusions, loss of sense of personal identity, schizophrenia-like symptoms, hallucinations, psychosis, distrust, and just fear. For cocaine metabolites, the mood symptoms include increased levels of anxiety, restlessness, feelings of superiority, euphoria, panic, irritation, and fearfulness. The behavioral symptoms include extremely talkative while high, a varying increase in energy levels, stealing or borrowing money, decreased need for sleep while high, increased need for sleep after usage, decreased appetite, erratic, bizarre behaviors, violence, abandonment of once pleasurable activities in order to get high, reckless and risky behaviors, the inability to sit still for even short periods of time, constantly rubbing runny nose. Some of the physical symptoms would be headaches, muscle twitches, malnutrition, abnormal heart rhythms, constriction of blood vessels, chronically runny nose, nosebleeds, nasal perforation, increase in body temperature, increase in heart rate, an increase in blood pressure, decreased appetite, dilated pupils, sexual dysfunction, gangrene of the bowel, risks of HIV, hepatitis, and other blood-borne pathogens, tremors. Psychological symptoms include intense paranoia, psychosis, violent mood swings, hallucination, break from reality, cravings, inability to exercise good judgment, rationalization of drug use, lack of motivation. Amphetamines. The mood symptoms include euphoria, increased alertness, irritability, mood swings, depression, and anxiety. The behavioral symptoms are hostility, aggressiveness, altered sexual behavior, not sleeping for prolonged period of time, not eating for prolonged period of time, unrealistic ideas of personal ability and power, fast and excessive talking, grinding of teeth, increased confidence. Some of the physical symptoms are increased body temperature, increased blood pressure, dilated pupils, faster breathing, decreased mouth fatigue, dry mouth, decreased appetite, nausea, headache, irregular heartbeat, malnutrition, and blurred vision. The psychological symptoms are paranoia, psychosis, hallucinations, clear and focused feelings. Opioids. The few mood symptoms we have are depression, mood swings, agitation, anxiety, and irritability. Our behavioral symptoms are drowsiness, slurred speech, doctor shopping or visiting a number of doctors to obtain prescriptions or for more opioids, using large amounts of opioids than prescribed, using medication in a manner that is intended, taking opioids for longer than prescribed, persistent, unsuccessful, or taking opioids for longer than prescribed, persistent, unsuccessful attempts to quit taking opioids, a desire to cut down on opioid use, preoccupation with obtaining, using, and recovering from the effects of opioids, craving opioids, compulsive opioid abuse, usage of opioids results in failure to fulfill roles at work, home, school, or socially, recurrent usage of opioids despite negative consequences, using opioids in physically dangerous situations such as driving, decrease in personal hygiene. Some of the physical symptoms are constriction of pupils, constipation, inability to regulate temperature, hypotension, itching, cough suppression, pain relief, respiratory depression, tolerance, withdrawal, and sometimes even coma. Psychological symptoms include hallucinations, delusions, memory loss, delirium, psychosis, worsening mental illness, changes in personality. Now we are going to move on to PCP. The mood symptoms include psychological cravings, continued use despite awareness that it is resulting in psychological problems, sedation or becoming overly calm, euphoria, mood swings, intense anger. The behavioral symptoms include drug is used in higher doses or more frequently than intended, unsuccessful attempts to cut down, the individual spends a lot of time obtaining, using, or recovering from PCP, inability to fulfill major life responsibilities, important activities given up due to use of PCP, loss of important relationships, unusual behavior results in individuals ostracizing the individual, social withdrawal due to odd perceptions of others and living in a loss of relationships due to arguments over drug use, consequences of drug intoxication, and physical fights. The physical symptoms include physical cravings, continued use despite being aware that it is resulting in psychological problems, tolerance, or the need for increasing amounts of the drug to produce the desired feelings, numbness, slurred speech, blank, wall-eyed stares, or staring off into space, hypertension, tachycardia muscle spasms, lung secretions, and stuttering. These psychological symptoms include inability to make decisions, amnesia, lack of motivation, getting caught up in a delusional system to the point of the individual believes that it is reality all the time, difficulty paying attention, hallucinations, delusions, paranoia, and psychosis. On to alcohol. The mood symptoms include depression, anxiety, hallucinations, mood swings, restlessness, and agitation. The behavioral symptoms are alcohol used for a longer period of time or in greater amounts than intended, desire or failed attempts to cut down on alcohol use, a great deal of time is spent obtaining, using, or recovering from alcohol. Alcohol use leads to failure to fulfill major role obligations. Continued use despite recognition that alcohol disorder has led to repeated interpersonal or other problems. Important activities abandoned due to alcohol use. Recurrent use in situations that could be dangerous, such as when driving a car. Continued use despite recognition that alcohol use disorder is related to chronic psychological or physical illness. Violence, extreme aggression, and fatigue. The physical symptoms are slurred speaking, red eyes, liver disease, itching, withdrawal effects if alcohol is not consumed regularly, shaking, tremors, sweating, diminished capabilities to perform actions with large muscles, an unsteady gait. Psychological symptoms include alcohol cravings, belief that one is more desirable when drunk, reckless behaviors, driving under the influence, risky behaviors, unprotected sex, poor judgment, delusions of grandeur, tolerance, and withdrawal. And these are my references for all the information that I found. I hope you have a nice day.